Hello, everyone. Welcome to yet another Indo-Indians information session. This time, we have a very special session with our friend, Dr. Ajiantoro from the Primaya Hospital. He has very kindly and generously shared his information about scoliosis. Scoliosis is a condition of the spine in children. It happens during the growth spurt, usually between the ages of 10 to 15 years old. And it is good for parents to know. It's good for parents to know what their children are going through so that they have the best development process possible. And I'd like to introduce to you Dr. Ajiantoro. Pa Aji, welcome. Welcome to the Indo-Indians information session. Thank you so much for sparing your time to be here and to sharing your valuable information with us.
Okay, Ms. Poonam.
So, Pa Aji, can you tell us a little bit about scoliosis? And what is idiopathic scoliosis?
So the scoliosis is some disease because there is some curve in the back. We have a spine. The spine is from the cervical and then in thoracal and in the lumbar. When patients have a scoliosis, there is a curve. It can be C curve or S curve. Okay. And then the scoliosis happens in adolescence, about 10 until 18 years old. We call it idiopathic scoliosis. Idiopathic means we don't know what is the factors and the etiology of the scoliosis.
It can be. So we don't know the reason why it happens.
Yes, we don't know the reason because what happens in the patients, why the scoliosis is not came in the childhood or early birth. It's like a congenital scoliosis, but in idiopathic scoliosis usually happens when patients have first menstruations or menarche, about 10 until 11 years old. And then after that, the curve in the spine will progress until 18 years old, because in 18 years old, the growth development of the spine will stop. I think this is a little bit definitions about the scoliosis, exactly about the idiopathic scoliosis.
So, Pa Aji, this is mostly in girls, or yes, it can also be seen in boys?
Yes, mostly in girls. Scoliosis also 9:1 for a girl and a boy. I don't know why, because this is a scoliosis, mostly in the girl, around 9 until 10 years old. So the problem is we have to prevent the curve being progressed. So the best one is to check and screening all the students or all the children's around 9 and 10 years old.
I see.
And also in 13 years old. It can be happened in a boy, but it's very rare. And usually if happens in a boy, maybe because not idiopathic, maybe because some reason like a neuromuscular, the patients have a congenital or others like that. One of challenge is preventions. Right now, I think many high school or junior high schools pretend me to do the screening scoliosis in the 10 until 13 years old children. So the preventions makes the scoliosis can be earlier detections, so we can predict the curve progressions in the futures, and then we can slow the progressions of the curve. Because why? Because if the curve is very progressions, and then the curve is more than 50 degrees, the patients will need the operations. And then all parents never want the children's going to operations, Mrs. Poonam. Because why? Because there is some complications, a risk factor of the operations like bleeding problems, infections, not only that, like neurological problems, You can use a paralysis after the surgery. It's very, very common to do the surgery with a risk and the complications. So preventions makes early detections so we can predict and prevent the progression of the curve.
Correct. So before we proceed further, Pa Aji, I know you have a presentation for all of us. And before you go, I'd like to also explain to all our viewers that Dr. Aji is an orthopedic surgeon and he specializes in the spine.
Yes.
And he has a lot of experience, and currently he is with the Primaya Hospital. And
Yes.
if any of you would like to consult with him, please go ahead. He's a great doctor and he specializes in the spine. So Dr. Aji, please proceed with your presentation.
Okay. I will share my screen.
Yes, please.
Okay. You can see the topic, Mrs.
Yes.
Purnam?
Yes.
Okay. Okay. Here we come. Scoliosis. Scoliosis in the children, idiopathic scoliosis. My name is Ajiantoro. I'm from Primaya Hospital, Tangerang. I stay in Jakarta. Mrs. Purnam also stay in Jakarta. Firstly, I will glad to hear in the Indo-Indians to give some educations, topic educations about the scoliosis, because scoliosis somehow it's a very, very we call it is not like a disease, because some girls can have a curve, but the curve is not progressions. I will educate because the scoliosis can be progressions. Okay. Firstly, the patients will come with a back pain. 7 out of 10 people will have a back pain. Health and fitness help the back to function optimally. I will show the back or the spine first. The causes of the back pain is usually because the lack of physical activity, the muscles weakness, a poor postures, and sometimes back pain can be caused by excessive activity. So the back pain can be caused because the lack of physical activity and also the excessive activity. How can the spine work efficient? So if you look at these pictures, the spine is like a block arranged on the chairs. If the blocks are pushed, they will move out of place. Okay, they need a fastener, and the fastener is a muscles. Okay, sorry, it's mean that the muscles is very, very important to make a stronger of the spine. So the scoliosis also we can now imagine about the curve not really happens in the bones, but also happens in the muscles. Because why? Because there is imbalanced muscles when the spine is make some curve. Muscles maintains balance. If the muscles on one side are weak or elongate in the scoliosis like the pictures, while on other side are strong and shortened, the body will lose the balance. So the importance of the scoliosis, not only the progressive of the curve, but also imbalance. Example is, if the patients have a curve in the body, you can imagine that the shoulder will not balance. Okay, so it will makes the patients imbalance. Patients will walking like a not normal people, like imbalance, maybe to the left side or to the right side, depends on the curve in the spine process. The posture problems, excessive curvature in the lower back, it's called lordosis due to the muscles weakness. Meanwhile, the kyphosis in the upper back due to the shrimp-like position. So in the scoliosis, not also we predict in the AP or from the front, but in the side way, we can know there is some problems. It can be kyphosis or bending over or lordosis, extend over like that. What is scoliosis? Scoliosis means that I explained before, there is a letter S or C in the back. Everyone has natural S-shaped spine from the side view, but from the front, patients have S view, not like a normal straight or vertical. A side-to-side curve of more than 10 degrees is called scoliosis. Below 10 degrees, we call only spinal asymmetry. So don't be forget. Below 10 degree is spinal asymmetry. The scoliosis means if the curve more than 10 degree. On the anterior posterior X-ray, it appears can crook from like a S or C, but the scoliosis not only a two-dimensional deformity, but three-dimensional because in scoliosis, not only the curve, but also there is a rotations of the we call it the costa or a hemithorax of the vertebra. So not also patients have the imbalance, but also uh, the the body will rotate, and because that there is entrapment of a lungs. So the patients came like a shortness of breath, and then the patients usually is lack of the activity because the patients cannot breathe very well. The importance, we have to pay attention in the children's more than 8 years old. The symptom is, if you look it in the pictures, you can prevent and screening your children's, okay? Take off the clothes and then see in the back. We can also mirroring in the patients, and then pay attention in the shoulders. The symptoms first is patients have a shoulder imbalance. And the second one is a prominent shoulders blade in the scapular area. And then after that, the patients have waist and hip are not the same because the waist and hips is more bulky. So the waist and hips is very, very not clear and very, very hard to detect if there is not same or level. But the shoulders is a symptoms that very, very easy to see. And then if you see the pictures, the patients have to bend forward and then see in from the backside, and then you can see there is a prominence blade, okay, like this. Okay, you can see my pointer. This one is blade, okay, and usually in the right side of the upper of body. Scoliosis screening is very important, routinely carried out in every elementary schools of around 10 years old or 13 years old. Screening schools can predict patients to the right doctors. They can receive earlier treatment, and definitive diagnosis must still be confirmed by us orthopedic surgeons. What cause of scoliosis? The most important is we have to know the scoliosis is divided in three. The first is congenital, present at birth. So earlier, after the birth process, we can know the patients have scoliosis. The second one is degenerative because due to aging process, again, a neuromuscular problem because nerve disorder. But the important is idiopathic because 80 until 85% cases is idiopathic. We don't know the etiology or the reason why the scoliosis happens. And the girls is 8 times often have a scoliosis than boys. And also, we don't know why this happens. This is the myth and fact about scoliosis. Does calcium deficiency cause scoliosis? It's a myth. Does carrying back on one side causes scoliosis? Also a myth. Most of the parents ask to me, because the carrying of back or others, but it's a myth. Does scoliosis definitely affect the birth process? No. It is scoliosis inherited disease in idiopathic is also myth. Can corset strengthen the spine? And don't forget, the corset not for strengthen the spine, but also to prevent the progressive of the curve. And does implant is used scoliosis surgery active the alarm or the airport? No. Right now, the implant of the scoliosis after being some operations is titanium, not steel. So it's very, very safe. How to prevent the scoliosis? First, early detections. Some patients have to detect by a teacher, school, physicians, somehow in while the patient is take off the clothes or get a swimming activity in school. It can be early detections. It's very important. Patients have to bend and then you have to check the shoulder blade and also the shoulder level. Carry a balanced load, example, a school bag on the left hand and right shoulder. Do not watch while lying down and sideways. And regular exercise and physical activity is very important to create the muscle strengthening. What if your parents, you and your family have a scoliosis? So this is the questions that patients and parents often share to me. First, you have to go to orthopedic spine. Because why? Because you have to get some scoliosis profile like this. We're counting the standing height, sitting height, body arm distance, shoulder tail, pelvic tail, rib hump, waist hump, plumb line, and a discrepancy of the lower leg. Okay, we have to check first. And then after that, we did a X-ray long vertebrae. Okay, long vertebrae, not only in cervical, not only in the thoracic, not only in lumbar, but also in the long vertebrae from the cervical to lumbar. Okay, because why? Because we have to make a scoliosis program like this. We have to detect what type of the curve and then how a degree of the curve. Like this, you can see in one X-ray, there is a three curve. Proximal or upper thoracic, they have a 32 degree, and the mid thoracic, they have a 66 degree, and in the lower thoracic, they have a 38 degree. And then we have to counting with a bending X-ray. And then after that, we got a diagnosis. After we get diagnosis, this is a treatment. Okay, I will give three type or three character of the scoliosis. Less than 25 degree in the growth age, 10 until 18 years old. You have to improve lifestyle, daily activity, rest when pain occurs. We give the analgesics and drugs if the patients have a pain. Medical rehabilitations, back strengthening, yoga, swimming, exercise, pilates can be done. Don't forget to do the regular X-ray observations around 6 until 12 months until the growth age is stopped in 18 years old. Okay, this is the group 1, below 25 years old. And then the second one, if the patients have in the group 2, 25 until 50 degree curve in the growth age. So it cannot be observations alone, but we have to do some bracing. We call it the Boston brace. And after the Boston brace, usually the curve will decrease. Boston brace have to get minimally in a day is 16 until 17 hours. At best, we get some bracing in the 23 hours. So the brace take out only the patient's while shower. Okay. And then with the bracings, we have to observe every year. So the patients every year will take and will put the X-ray long vertebrae again until 18 years old. If the curve not progressive, so the brace can be stopped in the 18 years old. Okay. And then how about the group 3? If the curve more than 50 degree, and this cannot be take a brace or observations, the patients need going to be a surgery. So the difficulty of dealing is a severe deformity. Like this in this picture. This is not animations. This is my patients. The scoliosis curve more than 150 degree. So you cannot imagine how the patients looks like. Okay, because why? Because the patients is neglected cases, cannot be screening in earlier, and then patients came with difficulty, shortness of the breath, pain, and also we call it is a decrease of the muscles and neuromuscular problems. So we don't want this happen. Because why? Because in early detection and screening, we can make a step for treatment of the patients. Why? Because if the patients came in a very severe degree of the scoliosis, the operations will be difficult like this. We have to put the implants. We have to put the implants very safe. But in the spinal, there is a spinal cord in the center, like this. The implant inside to the spinal cord, and it will cause the damage of the nerve and can be make the patients will paralysis. So like these patients with the severe scoliosis, it's very difficult for me to operate these patients. So as soon as possible, patients came and we know around 60 degrees, 70 degree, or more than 50 degree, we have to do the operations. Don't be late, because if the patients came more than 90 degree, the operations will very, very hard, and the risk of the complications will increase. Okay. So the conclusion is scoliosis cases idiopathic are usually overlooked by patients and parents because the initial complaints are not severe. Maybe patients only have some back pain, okay? And then early detections by screening is very important. A diagnostic must be made, determine, further manage the plan, and early treatment is very important, not for the progressions of the curve, but also the patient safety. Thank you. My name is Ajiantoro. I have Instagrams. You can also direct message to me in Instagrams if you have a questions. Okay, Mrs. Poonam.
Yes, Pa. Thank you so much for sharing. Let me enable my this spotlight. And Pa, maybe I can ask you to stop screen sharing. Yes, thank you so much. So, Pa Ajay, a very interesting presentation. I also noticed that you said that if the spine curvature is less than 25%, then
25 degree.
25 degree, then they do not need an operation. They can do it through lifestyle changes.
Yes.
A little less than 50 degrees, then they need to wear a brace. Now, in the 23 hours of wearing a brace can be very, very painful for the child.
Yes.
So can there be some other process to help the child with, where they don't have to wear a brace?
So sadly, if the patients in the growth age, 10 until 18 years old, the scoliosis will progress. Okay. And then if the patients in the 25 degree until 50 degree, the patients have to wearing a brace.
I see.
The brace usually start in the 7 until 8 hour. We call it is night brace. Only in the night, patients wearing a brace. And after that, we tapering up. Firstly in 8 hours, and then after 2 weeks, 12 hours in the home, and after that, minimal is 16 until 70 hours.
Yeah, sounds like quite a tough
yes. So
treatment.
That's why we have to make a brace very convenient to the patients. There is some padding in the shoulder and in the armpit of the patients, and also the breast also molding first to a body of patients.
Right.
Okay. And usually the breast after 3 years, patients have to change the breast. Because why? Because the sitting height and the body height patients will increase.
How often do you see such patients when you go to a school? What is the percentage of children that you see have possible scoliosis? Maybe very mild also.
Yes, scoliosis happens in populations around 3 until 5%.
I see.
Only 3 until 5%. Not really many patients have a scoliosis. But like I said before, the scoliosis definitions if a curve more than 10 degree. If the curve is less than 10 degree, we call it only spinal asymmetry. It's not a scoliosis. So the scoliosis happens is less than 5% of the population.
Right. Aji, what if people who are adults find out that they have scoliosis? What should they do?
Okay. In adult, the literature and journal say if the people in adult more than 80 years old, if the curve is less than 50 degree, you cannot the patients didn't do anything. So increase the muscle strengthening, core muscle strengthening exercise like yoga. We have a Pilates, and then you can see in the YouTube it's crutch exercise for scoliosis. Swimming is the very important sports with the freestyle. Okay, and then you have to strengthening your back muscles and your core muscles. For why? For because I said before, spine is not like a bone also, but there is muscles tightening around the spine. But in the literature, if the adult have a curve more than 50 degree, the journal said that it will be progress.
I see.
Okay. Around 1 degree every 1 until 2 years. So every 1 until 2 years, the scoliosis curve will increase about 1 until 2 degree.
Right.
So the possibility for operations in the adult and more 50 degree is indicated.
Okay. We have some of our audience online. Maybe we can open it up to them to share their questions if they have any. We'd like to invite our audience to, if they have any questions, you could type in your questions or you could raise a hand and ask your question of Dr. Aji. Does anybody have any questions? Okay, Aji, we also see many adults who, when you were showing us that slide where there was a, where the spine was curved inwards and they had a protruding stomach. Yeah. So I see many adults have that problem, where they have that. What would you attribute that to? What is the reason for that?
Because, yes, I said before, the scoliosis is not two-dimensional from the front, but also from the side. Because why? Because there is a rotation. There is a rotations of the vertebra. So the patients usually have humps in the back, and also the stomachs. We call it the costal. Costal will get higher, and also because these rotations, the body of the patients, it like a crook like this. So if the patients have a 50 degree more, we have to do the operations. Because why? Because the rotations like that, the stomach is front off, and then the diaphragma. You know the diaphragma? Diaphragma is
helps you breathe.
Muscles, yes. Yeah. That will make your breathe and the function of your respiratory functions will decrease. Because why? Because the volume of your respiratory tract will decrease, and it causes because the rotations of the spine.
If it is less than 50%, do you think strengthening your abdominal, your core muscles will help?
Yes, absolutely. If the patients have a 50 degree less than 50 degree, core muscle strengthening exercise, and then don't forget, you can use some supplements like calcium, vitamin D, and then you have to make some sport activity like swimming, jogging, squash, Pilates, and also the yoga. It will make your muscles strong.
Right. So thank you, Pa Aji. That was incredibly informative. And
Okay.
so, it was wonderful to know that these things can also be controlled, managed through lifestyle, through your physical exercise. And if you keep watch, then you can be in the best physical shape for your children and for yourself.
Okay, Mrs. Poonam.
Thank you very much.
Thank you very much.
Thank
See
you,
you.
everyone, for joining in this wonderful session. Thank you, Pa